all those relevant stations, because I've got this vast, outstanding audience here, and I just want to make sure. You look very succinct,
Yes, ma'am.
but you're not copying me now, but it looks succinct, but it works.
Yes, ma'am, it does. This is all I need.
And he will not mind me saying that. I'm delighted to be here this morning, and really this afternoon we have a combination of those who have been on the front lines in dealing with this pandemic. As the President indicated, we had hoped that we would be on the downward trend, that we would be able to be welcoming our school children back to school, and that we would be welcoming our teachers, and that they would have the opportunity to have the kind of invigorating learning. We had hoped that our first responders would not have as many calls dealing with COVID sick people. As I was walking in here today, I'm dealing with a person that is trying to get in a hospital. Their circumstances are not COVID, but that's what we don't understand. When COVID fills the ICUs, our first responders, whether it's the police taking someone by way of their car or they're connecting with EMS, they may have a heart attack victim. And because our ICUs are full, we cannot get in to our hospitals. And we live in a community filled with the outstanding Texas Medical Center and their satellite facilities, and of course the United Memorial Medical Center system, who've been on the front lines taking care of COVID-19 Delta patients. So today I wanted to come and indicate that we are sternly in a crisis. We have, as of 2 days ago, 51,904 children in the United States, cases. We have teachers who are dying throughout the South, from Alabama to Florida, who are dying. We have schools that are completely closed. We closed their school here. We know our neighbors in Montgomery County, Conroe ISD, at the beginning, when they started, they went up to at least 1,000 COVID-19 cases among children. So today I wanted to come and really focus on what we as adults are doing, how we are undermining the very precious souls that we have. As I go back to Washington, I'll be discussing with my colleagues whether or not we should hold federal funds for states and school districts that are not courageous enough to begin a protocol for our children to live. In our hospitals are children with COVID-19. A little boy just about 2 days ago died living in South Carolina, a 4th grader, from COVID-19. These children are resilient, but they can still die. And we, who are adults, who can get vaccinated, we're not doing our job. We're letting the children suffer. Also, parents, those of you who can get your children vaccinated, 12 and over, we are not vaccinated at the maximum that we should. And frankly, I believe it may come to a time we can't get our hands around this. And we believe in democracy. I am as much committed to the rights of each individual. I would not want to live anywhere else but a country that is a democratic republic like the United States of America. But I believe that there will have to be more than incentives. There will have to be demands and requirements for federal funding. That if your state over and over and over again, Texas is a hotspot, along with Alabama, Mississippi, South Carolina, Georgia, over and over again. We were at a plateau at the beginning of the summer, and we have now surged, and they believe the surge is going to be even more extensive Labor Day weekend. But remember, adults who are not vaccinated are giving it to each other and giving it to children. How do you think children go home and come back and they are positive? And so I'm delighted to be here at the Northeast Command Station on Lay Road, a very vital part of Northeast Houston. Along with these officers, I thank you to Commander Dale. I hope I'm calling him by his appropriate title.
Yes, you are.
You can tell me whether it's general or whether it's the chiefs of chiefs. But what a wonderful expression for this command station, which I've always known over the years. They got a better looking building here, but on city council I've known them for a very long time. Dr. Beal, just come quickly, don't have tiptoe. That they open up their doors as true community citizens for us to get vaccinated. And one person said they heard on the radio. So I know one person heard on the radio, because I really worked to get this word out. Whole bunches that are sitting home somewhere and not coming to get vaccinated. What more can we do? So I want to thank you, Commander. Thank your officers. Thank you for this, I call it community relationships that have been established. From Chief Finner, I saw him just a while back. Thank him for giving his officers the kind of encouragement that we can see each other as family, as part of the community. Because we've got some tough fights, from pandemics to proliferation of guns and to gun violence. But I'm always a person that believes that we can get to the end of the road in a good way. We can get to a rainbow. But we are not doing that if we have all of our fellow citizens where we are just throwing vaccines toward you. Be mindful that MU is coming, MU. We have not determined what kind of difficulty we'll have with MU. All the Latin names. Delta, now MU, Lambda MU. And for people who want to grunt and say you get it anyway if you're vaccinated, you live. I have living proof of that. I'm dealing with people in hospitals that are coming out of the ventilator if they had some underlying condition, Dr. Barone, because they were vaccinated. So, Commander, you usually have to be the person that kind of talks a little sternly to the person who's run a light or has been in the wrong place at the wrong time. I know you believe in redemption, and I hope that some of these that you catch on the streets, knowing my attitude, Pastor Morrison, about helping young people steer in the right direction. So I hope the officers here will talk to those who can be saved, and everybody doesn't have to go downtown. But at this point in time, I'm taking a different perspective. I will be seeking to determine whether or not legislation should be put in place. The president is trying, but we're not getting through to people, and people are dying, and the numbers are high. We're having 150,000 plus persons a day who are infected with this disease, and the children across the nation exceed $250,000. It is 250,000 children and teens are suffering from the coronavirus, the largest number for the first time since the start of the pandemic in the week through September 2nd. Our hospitals in Houston are near capacity as the Delta variant spreads. And this is the beginning of this week. We're still at a nursing shortage. We still don't have enough nurses. I spoke just a few minutes ago or an hour ago to the Texas Human Health and Services. Health and Human Services, they don't have enough. We don't have enough military teams to be out. So we're stretching ourselves to a point, and let us take a moment to thank those first responders inside the hospital. Let's thank our UNMC medical team over here, because they've been out there. But if you will do an inventory of our hospitals and our public health system, they're on the margin of dealing with medical teams, respiratory persons as well. Not enough. And so today is a challenge, and you will hear from some of the medical personnel, the pastors, who will tell you that this variant is serious from their own religious perspective. Maybe we should have had a funeral home director, and I think I may have a press conference with them. Well, I hope that he can come forward, he or she, because there is no,
You're ready.
he had a mask on. We had a blessed service just the other day for a man who did follow what he was supposed to do. But what I will tell you, families can't see their loved ones. Because if they have COVID, the rules of the hospital is you can't come in. And so I spend my time working with hospitals to let families go to the bedside of a dying person. Brother Downey, they're dying. Because that is the standard by which you're able to get in, that your loved one is dying. We like to go to the bedside and give encouragement. Let them get better. They're going to dying people. So let me finish. It is important that the federal government has some kind of strength to demand people to vaccinate. We're not at a point where we want mandatory vaccination, but I want everybody to know this may prove positive for me or not. But I believe we will come to a point, if we cannot get this voluntary vaccination, we have people sitting here, and we have this wonderful volunteer right here. I want her to know that we appreciate you, because you are getting it done. In every one of our places, once we did have a surge, when we were doing the compensation. Compensation is ended. Those are federal dollars. That was the right thing for our county and our city to do. We thank them. But now it's about your life. And there may be a point that some of us will be advocating for mandatory vaccination in the hard-hit areas where we can't get the numbers down, where the children can't go to school, where they're not wearing their masks. And as most doctors will say, the easy thing to do is to keep your mask on, let the children have their masks on, let the teachers have their masks on. If we are fighting to get bus drivers because bus drivers are dying or getting sick, when people fly, they're giving it to the Transportation Security Administration officers. There is a surge in the Harris County Jail with COVID. Just because people are not making announcements, I'm making announcements because we're at a crisis. We are at a crisis. And what has got me to this point, before I get on an airplane and walk the streets of Queens with my congressperson whose neighborhoods have been devastated, and I pray for them as we pray for Louisiana. We're going there next week. Is that we will never get to a point where we can begin to turn the corner as long as we are not taking advantage of being vaccinated, as long as we're not helping our children by minimally letting them wear their masks. Every physician will tell you that the trajectory is that it is an aerosol, it is in the air, and that's how little ones can get it, that's how little ones can carry it. Sometimes little ones are asymptomatic, and they don't have the outward. And my last point that I'm going to make, I'll come back with some numbers, but the last point I want to make is, can you imagine the psychological impact on these children? They're resilient, but can you imagine? The children that lose both parents to COVID and now are transplanted to aunts and uncles, thank God for them. But both parents are gone. There are story after story about that. So the federal government is going to have to step in and make a difference. And I believe that there's going to have to be mandates where there is a surge. Let me start first with our commander and thank him for allowing us to be here. If you would come, and then we will proceed with those who are here with us, and we're so appreciative. We'll proceed with acknowledging them as well. Commander, thank you very much.
I just want to thank Congresswoman Lee and really my HPD officers here in Northeast. To be honest, I have done nothing here. It's Officer Miles, the other officers here that have coordinated and put this together and worked with their office in order to make this happen. And I think it's a great opportunity, not just to get the vaccination, if that's what you want, but also doing it in a police station with our uniformed personnel, our Houston Police Department officers to be here. We can have that engagement, community engagement, as Congresswoman Lee mentioned, the relational policing that we strive for, and so it's a win-win for everybody here. And if you can come in here and get vaccinated, and also visit with the police officers that work in your neighborhood, I think it's a fantastic idea. So my hats off to the officers here in Northeast that really put this thing together. I couldn't be prouder to work and serve with each and every one of them. So I'm not going to say anything other than thank you again. Hopefully we'll have more of these in the future. And I will leave it to the medical staff here that just so graciously came out here and have worked tirelessly all morning, making sure that our citizens in the Northeast area get vaccinated. So I will let MC speak.
Thank you so very much. Yeah, go ahead. So, what is the update? Well, let me move this as quickly as possible because I want Dr. Barone to be heard. Pastor Morrison to be heard, and I want to make sure that I have Director Wilson as well. He can speak generically that this is serious. And I want to acknowledge all the pastors. I know that he will not have this on his video, but in any event, he has a time. I'm asking him to do 15. I'm sure he can get to his other location time without too much danger. But thank you so very much. So let us, as I indicated, I've got two doctors, and I want them to be heard. Dr. Barone, you will go first. And as I do so, let me acknowledge the presence of the representative of our dear Councilmember Sheila Jackson. And we're delighted that you're here. Thank you so very much. You've been faithful. We appreciate our leadership. Dr. Barone is Chief Medical Officer of the United Memorial Medical Center. And they have a hospital system. He's going to speak. Dr. Janice Beal will follow him as it relates to the impact on children. Pastor Morrison represents this outstanding Northeast coalition of ministers who have, I've seen them out through this entire pandemic. I'm glad that God has got them because they have been with COVID and around COVID, and they have not stopped. I'm very grateful for each and every one of you, and we'll call your name. And then we'll have our director who will just give us a serious talk. We appreciate it. And Officer Miles, where are you?
I'm right here, man.
Let me give you a very big hand. There's a man I want on my team. As I give it to Dr. Barone, we've had 13. Just want to make sure this is one that I think is worth saying as I bring you up. Miami-Dade has lost 13 employees. They're dead. That is a school district. They're dead from COVID-19. Dr. Barone?
Thank you for this moment.
No time for smiling.
No time for smiling, unfortunately. 538 days. That's the number of days that we have been on the forefront of this. And, you are people are dying. People are dying, but vaccination works. And, I usually talk numbers and stuff like that. Let me give you an example. 2 weeks ago, I admitted the same day a 95-year-old African-American woman and a 20 27-year-old Hispanic young man. They both came to me. I was able to discharge successfully the 95-year-old woman 3 days ago. And yesterday, I lost the 27-year-old man. What was the difference between these two? The 27-year-old man was healthy, but was unvaccinated. The 95-year-old woman was vaccinated. Vaccines work. Whether or not we're going to push people to get it, that's a different story. But for God's sake, do what's right. Get the vaccine. The vaccines work. Forget about what people say that they're going to grow a third eye or they're going to grow a tail. That's not going to happen. Right now, that's going to save your life. So more than talking about numbers, I think, Congresswoman, giving them a real case is the best thing we can do. We, as clinicians, were exhausted. You have mentioned, we have, the resources that we have are limited. Our nurses are tired or are sick. We need all the help we can get. The system is collapsing, and it's going to get worse if we don't do it right. And one easy way to do it is get the support that you're asking for, and second, get people vaccinated. Now, let me just say quickly in Spanish for those Spanish patients. Estamos aquí con la congresista Sheila Jackson Lee, que ha estado trabajando intensamente por 538 días haciendo eso. Las vacunas funcionan. Yo he visto mucha gente que fallece que no ha sido vacunada. Tenemos ahorita demasiado exceso de trabajo dentro de los hospitales y lo único que podemos hacer para salir adelante es que todos trabajemos juntos. Yo les recomiendo que se vacunen. Gracias.
Thank you. Muchas gracias. UMC has been working to the bone, and I just want to announce publicly today that you are getting through the federal process and the state HHS. 7 nurses and 4 respiratory therapists will be coming. These are lifelines to them. They have not arrived yet, but you will be getting them, and I will be assured that you will be getting them into your facility. Dr. Dennis Beal is a child psychologist. She's been working with us. She has a brief moment on this impact on our children. Dr. Beal.
Thank you, Congresswoman. Often as a clinician, a child and adolescent specializing in children and adolescents, we often think that our children are not really suffering, or they really are, not really paying attention. This pandemic has had a devastating effect on our kids. So as they were approaching getting ready for school, there was a lot of anxiety and there was a lot of fear and apprehension about how they were going to go back into the classroom and be able to learn, and they were excited. But in the same instance, there's fear about whether or not they'll be able to continue throughout the school year. I heard from many children who called in from hotlines and different sessions that we had how fearful they were because their family members were infected by the virus. They didn't know what to do or how to, if it was going to affect them as well. And back then we were saying we weren't really focusing on children, but we know from the numbers that our children and adolescents are affected. So emotionally, they're trying to go back to school and learn, knowing it may not be for the entire year, it may be a temporary process, and they're fearful about what will happen when they come home. Can you imagine if one person loses, like the Congresswoman talked about both her parents? You lose one parent, it's devastating. 2 parents just totally wipes you out. And we're expecting them to be able to learn at the same time. They've had grandparents. I had one child that called on a hotline that called every other day because so many family members were affected by the virus. So if we're here to educate and teach our children, why don't we protect them at the same time? That means having them know that they're going to be okay because we're their protectors. But that means we also have to be vaccinated to be able to protect them. And if parents, if you don't do it for anything else, do it for your kids.
Yes.
Okay. Do it for them. Don't leave them here in this world trying to navigate this world without you. It's very, very important for whatever reason that if you decided not to be vaccinated. We know that 12 and under, but the 12 and above. I'm talking to adolescents, and they're telling me things and stories that don't make sense because they've heard the erroneous information from somebody else, and the information was not correct. It is important that we understand why it's important to be vaccinated, and that we want to be able to give them a sense of security. They have enough that they're trying to do. They're trying to get educated. They're trying to understand emotionally. They're suffering from depression and anxiety. The numbers are extremely high, and we don't have enough people in order to service them and give them a safe space. So we're trying to create programs to be able to help them understand and cope what's going on with this pandemic. So please, please, if I can say anything else, understand why it's important to get vaccinated, not only for yourself, but for your family, and for your children. And Congresswoman, I'm committed. We have a new program called Wellbeing in Color, for children of color, that we're working in order to be able to build in the coping skills to cope with the rest of this pandemic. And it's of no charge to anybody. So if someone wants to know, just give us a call. We'll be out your streets.
Children are frightened, and comforters are Dr. Beal and our pastors. Pastor Morrison, would you come introduce so that you can be heard before the gentleman has to go? I have been working with the Northeast pastors, and you remember when we opened up Forest Brook, and that was on testing. We fought for that, and then we opened up vaccinations, and so we're in an area that is not where we'd like it to be in getting vaccinated. So Pastor Morrison, we thank you so very much. Pastor M.D. Morrison, New Faith, thank you so very much.
Thank you, Congresswoman, and want to applaud you again for all of your tireless work. As you stated, I'm president of Ministers Coalition of Harris County and vicinity. With me also is Pastor Willie Claiborne Jr. of the Greater Shiloh Tabernacle Church, Pastor Eric Wilson, Spring Antioch, Pastor Louis Sidney, Greater St. Paul, Pastor Darren Payne, Cathedral of Faith. We've come to make an appeal to the spiritual nature of mankind. For many, excuses have been, it's not federally approved. We just received that last week, or some days before that, now the vaccination is FDA approved. Many say, well, there's a distrust, I have a religious issue with this vaccine. As those of us who strive in the Word of God, it is morally wrong to have the capacity to do right by your fellow man. And as the Bible says, shut up your bowels of compassion. It is morally wrong to do that. The proverbial writer said that a man that does not have rule over his own spirit is like a city that is torn down and without walls. Our nation finds itself now without walls, without protection. It seems as though the very fabric of our nation is falling apart. And it is because we are not taking responsibility to do right by our fellow man. Every Saturday I'm at a funeral, as Pastor Wilson will further elaborate on. I'm in the hospital. Very recent case of one of my members in the hospital, and I'm so glad for the assistance of Congresswoman Lee. The family was unable to go in and see her. Her husband of over 50 years. She was on a ventilator, but because of the assistance of the Congresswoman, the family was able to go see her, and the last we heard, she was able to get off the ventilator, and she's slowly recovering. But that lady had a vaccination. She was vaccinated. This is unheard of, and this is ungodly. We have to get back to the place where we value life again. Money should not be the driving force for us to get vaccinated. Amen. That is a shame. That is a shame. The love I have for my fellow man should be more than enough to get me vaccinated. It is time that we stop this. It is time that we value morals over money. That we value love over luxury. It is time now that we just love one another again. Thank you, Congresswoman, for what you're doing.
And let them know your business if you want to let me just say this. The state of Texas, there are 40 million confirmed cases. The state of Texas is still in the number one 13 to 18 states with 1 million cases. We have not been able to bring that number down. We have not penetrated. About a couple of weeks ago, we were about 5 million in the state of Texas not vaccinated, but it spreads. And the only thing that Governor Abbott has asked for from the federal government is 5 mortuary trucks to carry the dead. 5 mortuary trucks. FEMA has given us 5 mortuary trucks. We need military teams. We need more nurses because the hospitals are having to go in an open market and they can't pay the amount that is in the open market. They're paying enormous, and that's why I'm glad to announce the 7 nurses that are coming to UMCC and their 2 respiratory technicians. But 5 mortuary trucks is what has been requested by the state of Texas. We should be requesting nursing teams. But what is happening is that people are going in, and as Pastor Morrison said, families can't see them, and don't get a bad impression when you say that someone's in the hospital. They could be in for a variety of reasons, underlying conditions, but they're coming out. Where those without vaccination, you've heard what Dr. Rome said. What an amazing story. 95 years old and 20-something years old. 95-year-old is home with her family. Pastor Wilson.
Thank you, Congressman Lee. I am Reverend Eric Wilson. I am the pastor of the Spring Antioch Baptist Church. I'm a member of the Northeast Coalition of Ministers. I'm also the assistant manager of the Pruitt Funeral Home here in Houston. And I think we really should give Congresswoman Lee another hand clap of encouragement for her tireless work in so many of our issues, but certainly in this particular issue that we're talking about right now. I don't want to be redundant because a lot has been said that I don't want to say again. But I think you ought to know from the funeral industry's perspective, right now we are essentially saturated with new cases. It's hard for us to even keep up with the amount of calls we're getting every day that are a direct result of this pandemic. So again, I don't want to be redundant with that because we keep hammering it home. What I would like to say is that what we're observing in our industry is the emotional impact this is having on everybody. I mean, it is literally the residual effect of this pandemic is such that not only are lives being lost, but lives are being altered forever just because of the nature of the deaths and what families have to go through before they get there. I would encourage you all, again, to get vaccinated, get tested, get vaccinated. We just did a testing at our church this past weekend because we want to do our part as a church to always keep up with what's going on and be a contributing factor. But Congresswoman Jackson Lee is a tireless participant and leader. I think if we just keep her out front, everything will be all right.
Are there any questions that have been given to you to answer?
No, ma'am.
Then let me conclude if you haven't turned off, so let me just conclude. And we will continue because I want the community leaders to speak as well. But just on this moment, let me just conclude. We're here in Northeast Houston, which is an older community, which we look to be revitalizing because of the leadership that we have here. But we're also in a community that can suffer at a higher level because of the economy and because of the impact as it relates to access. Lyndon Baines Johnson is in this part of the community. Their ICUs are full. Their hospital beds are full. It is a challenge for there to be access to medical care here for someone who has a heart attack, been in a car accident. And that's what the community needs to understand. When you're in a bed, we're going to have you in the bed, but you've got COVID-19, whether you're at the medical center or you're at LBJ or Ben Tom, or you're out at UMCC or you're out in satellite hospitals, you most likely, because your time there is going to be long, you're going to have it be very difficult for others to get health care and access. Secondarily, if you happen to be exposed to COVID-19, the Delta variant, which is very infectious and get sick, it is most likely for you to come out of the hospital if you're vaccinated. And let me say, these are rare occasions. Most vaccinated persons can be able to fight it. but if you are sick and vaccinated, you might get out. In fact, you'll get out. That's what we have found. But those persons who are strong, those persons who believe that they are athletes, or they are rappers, or they are young, or they are robust and not vaccinated, for some reason or other, Delta variant does not care. It does not care how good looking, how robust, how diverse you are, what your profession is, how you've been running or walking or exercising. It will kill you because you're not vaccinated. And as I'm not a doctor, but I've lived around it, your lungs turn white, you cannot breathe, and the ventilator cannot help you. And then science has not yet told us the long-term effects of having COVID. And as Dr. Beal said, as Dr. Barone and Dr. Beal has said, what is happening to these children? That they lose someone close to them. And the 27-year-old might have had younger brothers or sisters.
2 and 1.
Oh my goodness, he had 3 children. 3 children. Can Houston understand where we're at? And this is across racial lines. I'm in Northeast Houston. It's got all kinds of people living in Northeast Houston. I represent everyone. And we're having problems with everybody, no matter what their background is. They are just not paying attention. So you've got devastation in Louisiana, just deviating for a moment. You got close to 500,000 more, but there are people walking the streets with nothing. You got people in the Northeast that just never experienced this. They stand outside their house just asking for any measure of help. If COVID starts getting in these groups that are not vaccinated, that's another surge because of the pandemic mixed with the devastation of no place to live, but only shelters. We are praying for the hurricane season here to pass us by. But if by chance there's some measure of it, some of our friends and relatives will be in shelters. Just imagine, unvaccinated. So I do believe with these numbers, we'll have to reach a moment of making a very difficult decision of mandates in hard to serve areas, or surging areas, tied to federal funds. It is provocative, I understand it. But what is our next step? We have begged, we have paid, we have opened, we have gone to schools, and that's where I'm going to start going now, to the actual schools during the week and on Saturday, so that I can help these parents. Maybe they're working. Get these 12 and above vaccinated, and once we get the other vaccination for 12 and under, the little children will take it. The little children will wear masks. Just watch them. They're obedient. They will do as you told them. So, we thank you all for being here. I want to make sure that I let Keith Downey and, where's my friend? Oh, yeah, both of you come. So, would you just come from the community very quickly, please? As they say in the church, would you come quickly?
Come on, good. My name is Keith Downey. I'm Super Neighborhood President for Cashmere Garden. Everybody knows somebody who has either had COVID or knows somebody that knows somebody who had COVID or had COVID themselves. I have no right to say you don't love yourself, your children, and your healthcare workers, but you can love them better. You can show love and compassion. I don't want to put strain on healthcare workers. I got the 3rd vaccine now because I'm immunocompromised, because I'm an asthmatic and the weather's starting to change. Because I don't want to wheeze at night. Because I don't want any respiratory illnesses. Because the seasons are changing. So lead by example. Our children, they follow what they see and they follow your words and what you say. And they'll raise their kids the same way. So we must get vaccinated. 3 vaccines, and I'm here to talk to you. So it doesn't kill you. It keeps you alive. Thank you.
Thank you.
Good afternoon. I can say I've lost family members. In a matter of 30 days, we buried 2 robust young men in our families. Mothers and grandmothers. I'm not just begging you for me. I'm begging you for your children. As we go into the schools and we look at their little faces, it is terribly hard for them to recover from a year and a half of being homeschooled. But imagine the lifetime that they've got to endure without a parent or both parents and their grandparents. I beg you, my community, Northeast Houston, we work for you on every front. When we called out to Congresswoman Lee last year and said, we have no testing, we had testing.
Yes.
We called out and said, we have no vaccines, we have vaccines. There are no excuses. You've run out. So take this opportunity before you're in the hospital asking for a vaccine so that you can see your kids again. Take the vaccine now.
Please.
Thank you, Congresswoman.
Thank you.
Technology code over here, to make sure I've got long list very quickly. April Lewis, Sabrina Romes, John Lundenhomer, Frida Nareen, I got Chris Brown, I got you, Tyler Jones, I got you. Midway Jones, is that everybody? Did I call our leaders? Ma'am?
I'm in the real from ECC
Yeah,
City Club.
okay, dear. You got a mask on.
I talk loud. I want to thank Congresswoman for being here this evening, and I would like to let her know and everyone know that we at ECC City Club will do all that we can, physically, emotionally, and we'll be out there for everyone who want to come and get vaccinated, everyone who needs to be tested. We are available. ECC City Club is right here off ECC Road, and you're welcome to come out there, call us. We're here for the neighbors. Thank you.
Representative Councilmember.
I just want to thank Congresswoman again for all of her efforts, for everything that she's done in District B, just throughout the city of Houston, period. We still stand at the ready, and Councilmember stands at the ready to partner with you for any efforts that are taking place within the District B. We have reached out to all of our partners. We have a very strong connection with Houston in Action that allows us to leverage other nonprofits and other people who want to lead vaccination efforts throughout the city of Houston. We are a resource, and we desperately are asking you to come to us. We have gone to every avenue that we possibly can to reach out to help out to get this vaccine in as many arms as possible. So we are just continuing the effort, and we are going to stand as strong as we can beside you to get this vaccine taken care of.
Thank you. If I didn't call his name, it looked like he had to leave, which was Pastor Stern, so please, we want to thank him as well. And I just want to make sure, I think, Pastor, you called all of our wonderful pastors here. My good friend, call him General Sidney, because he's got his son who's out on the battlefield. We appreciate his family and everything. Let me conclude my remarks indicating that we've got a big task in front of us in Washington, dealing with the Build Back Better. That is the $3.5 trillion that is going to literally get to communities like Northeast Huey. This is going to get to you. This is a investment in people. Your family is going to be able to get your families that are out here paid family and medical leave. We're looking to expand Medicaid. We're looking for the child tax cut. We're looking for the pro-worker incentives. We're going to be dealing with some housing. You're going to be funding. This is what's going to be in the $3.5 trillion. And let it be known that the $3.5 trillion, to my dismay, my colleagues are making havoc and trying to be a lone wolf. This is no time for lone wolf. This is time for unity. It is over 10 years. This country is huge. We have spent $1 trillion in Afghanistan. I'm not going to undermine that because we had a purpose. We were attacked. But when someone wants to say from states that are so impoverished like West Virginia that we don't need to spend $3.5 trillion over 10 years to be able to put people back to work, to be able to provide universal pre-K. Do you know what happens when a child gets access to education early, that they're not able to get it? They don't have the dollars that they need to do so. So there is a myriad of things that we're expecting to be able to get, helping small business, helping veterans, upgrading veterans facilities. and providing emphasis on climate change. And the same thing with the infrastructure. We have a number of backlog infrastructure projects, particularly our bios, and you all know that are long overdue. The INVEST Act is going to invest in these bios down here. We're going to invest in ensuring we're going to be fighting for some dollars for that Ike Dike that you all have heard about, so that we can be able to live in a place that we love. We don't want to move. Same thing that our poor brothers and sisters down in the parishes that are now suffering. We've got to find a way to help them as well. We can't do it if we are still in September, October, November, and December of 2021 into 2022 dealing with COVID, Delta, and Mu, and people are not vaccinated. We just won't be able to turn the corner or turn the page. So I'm very glad to have you here, and I don't want to move us to mandates, but what is the solution, Gabrielle, where we cannot get people to pay attention? So I want to thank Dr. Barone in his absence. He had to rush back to the hospital, rightly so. I want to thank Dr. Beal, council member, Pastor Morrison, Pastor Wilson, and of course our community leaders. Thank you so very much. You do great work out here. Call me again, and we'll be on the battlefield. I'm hoping that we might get through this season. We see what has happened in Louisiana, but we just need to be prepared. And I want to warn you that the season is not over. It goes all the way to November. And so can you imagine you're not vaccinated and you're stormed out of your house and you're just somewhere where people are exposed, or you're exposed, or you're jammed up in a convention center? Just imagine Hurricane Harvey. I lived down at the George R. Brown. If COVID was there at that time, somebody just said it would have been bad. Because we had people in there. We had people in NRG. We had people everywhere. Churches had people on the floor. Can you imagine? And so please, as has been said eloquently by Huey, my goodness, losing two wonderful young men and others. Get vaccinated. That's what I want to leave you with. Get vaccinated. We're on these planes, these sardine planes, and I'm just praying. Try to get a sip of drink or something, and I'm just trying to say, oh, Lord, let's hope that I can sip this drink and get out and not have something go up my nose. Because I've got to be the one flying back and forth, and I'm in a sardine can, no disrespect to flying, and you got to take off your mask. Oh, boy. Just to try to get a sip of water. Who would have ever thought? Everybody's trying to huddle down to make sure they're like this. What kind of lifestyle is that? Is there somebody listening? Do we want our college students on campus? What kind of lifestyle is that? They need to be all vaccinated. There shouldn't be one college student not vaccinated. You're all in dorms and in classes because you're not, most of you are coming back now. Because everybody's coming back. This is the week that everybody's coming back across America. And that is why this surge is coming up, because these little kids are coming back and they are infected. So with that in mind, I want to thank you all for coming. I need to thank you. I certainly don't mind trying to be a armor bearer for my constituents as I'm dealing with the situation right now. But the point is that I'd much rather be talking about the houses being built, the great work that we're trying to do with the mayor of the city of Houston and his leadership, federal funds coming, people being out and about in beautiful weather like this, and not families hovering at the door of a hospital because they simply cannot get in because of the protocols that are necessary to protect the nurses and others, and you're just outside the door. We saw those pictures, people outside the window begging to see a loved one. Please understand that. So thank you very much. My final words, and let me thank you, MC, for always being there when we call at our schools and elsewhere. Our new vaccine person is last name? Lopez. Oh, we're so happy for Miss Lopez. Thank you. We are. And if you could spread the word, okay? Thank you all very much. Applaud yourselves. Thank you. Thank you to the commander.
house. Thank you all so very much. A great team.
And Congresswoman, I want, when you go to Congressman meets in Queens,
Yeah.
tell him from an ex-Brooklyn Queens resident, but also all of us in the room are praying for Queens, Brooklyn, Manhattan, and around. He has prayers from us down here.